part of the Practice 911 series, how to transform your time-sucking, underperforming practice and put more money in your pocket. We're directing this at chiropractors this time because we're hoping that we can actually help the profession to grow. This video is actually part of a series. We're going to try to keep them around 15 minutes long so that you can digest the material in bite-sized increments. And what we're going to talk about is why chiropractic hasn't grown and what you can do about it. In the last 50 years, the percentage of people seeing chiropractors has actually decreased. It traditionally was around 10%. I've heard numbers as low as 6% now. And I wonder why that is. One thing is we do extremely poor marketing. We have extremely poor positioning in the marketplace. People think of us as doctors of kinks and strains. And we have very poor communication and patient education. We seem to be obsessed with teaching people about the philosophy of chiropractic and all kinds of other nonsense. And it really hasn't helped the profession to grow. We are our own worst enemies. We created this public image where we're all about bones. You have to keep coming. The old joke is it takes one chiropractor to put in a light bulb. It takes 99 visits. We should be looking for those miracle cures that so many practitioners enjoy. And people think of us as treating kinks and strains if they're not too serious. Is it any wonder we see less than 10% of the population? And really, we should be doing much better than we are. There is a $3 trillion annual health cost in this country, and a lot of people are not being helped. There is no shortage of sick people. $1 in every 6 goes to health care. And as healthcare costs increase, services has been decreasing. We're finding medicine isn't even doing what it usually does. People are being processed and not treated. And this is an opportunity for chiropractors. We can actually be the phoenix that rises from the ashes of American healthcare. Healthcare in the United States is a mess, and it is an opportunity for chiropractors. Patients are not getting treated, they're getting handled, okay? And when you think about it, most health problems are a result of inflammation and nutrient deficiency. And if we get in the habit of addressing all chronic health problems nutritionally, chiropractic can grow your practice will grow and chiropractic will grow as a profession. So the image of chiropractors, instead of being freers of innate intelligence or musculoskeletal specialists, back doctors, we should really be thought of by the public as physicians who are not owned by the drug industry, that we treat pretty much anything. And straight chiropractors talk about treating everything. Unfortunately, they talk about the only treatment as being an adjustment, and that's a terribly inefficient way to address a lot of chronic health problems. But if we develop credible treatments for all chronic complaints, and we get better results, and I have to talk about results, because if you ever see a practice that's doing really well, it's because they're getting results. I mean, marketing is important to get you going and all that, but why do people go to a physician? Why is a physician popular? Because people can trust them, people can do better in that office, and if we had more chiropractic offices that were getting those miracle results, we would all benefit. We need to become everyone's trusted health resource. So there are 3 easy steps to growing your practice and I think ultimately growing the profession. Okay, and even struggling practices can redefine themselves and thrive. You first begin by specifically marketing for the kinds of patients you are good at treating. If those are musculoskeletal patients, so be it. But you do want to develop turnkey nutrition programs and market those. There's a lot of simple nutrition you can do that will increase your income and grow your practice and improve results. While you're doing that, the third step is to be expanding your technical skills. For instance, you might find that you treat asthma reasonably well, but you might come across some asthma patients that you're not getting the kind of results that you want with. You should seek out people who have suggestions and can help you with those problem patients. And over time, you will get busier. The combination of chiropractic and nutrition is a powerful one clinically. And it will grow your practice. It gives you results. It gives you referrals. It improves your reputation and will pay you remuneration. You will make more money, although hopefully that's not why you're doing it. And I believe that the systematic utilization of nutrition is vital to your practice. If you're not doing nutrition, I mean, just to look at it from a money point of view, take what you're making now and increase it by 40%. That's what regular use of nutrition will do for your practice, okay? And it will grow because of results, because of the $3 trillion people are spending on healthcare and not getting very good service, okay? Medicine manipulates symptoms. We say that all the time. But we don't offer a credible substitute. An adjustment is a good thing, okay? A chiropractic adjustment works because of somatovisceral effect, okay? You might be treating backache or neck pain or whatever, but who hasn't had someone tell us that their sinuses have gotten better, their allergies have improved, or their digestion has improved just from being adjusted? And the percentage, one of the journals published that the percentage of patients with indigestion that respond to adjustment about 23%. The problem with that is you can get close to 100% if you add nutrition to the mix. And people go to a doctor, chiropractor doctor, any kind of physician because they want some sort of a result. Okay, they don't come to you because of your philosophy or anything like that. You should be able to manage a lot of these simple complaints, and because there's a market for it, because medicine's not doing it. When talking to chiropractors about utilizing nutrition in their office, I hear a lot of odd statements. One is, my patients won't be interested in nutrition. Your patients are your patients because they're attracted to you. If you become proficient at handling patients with nutrition, you will have patients that are interested in nutrition. Also, a doctor that'll say that a lot of times thinks of nutrition as simply selling vitamins. And although there's income from selling vitamins, you really, really, really want to be effectively managing and effectively improving their health with it. No, everyone's interested in that. If you got a chronic problem and someone has an answer for you, believe me, you're interested. Experts are pegging wellness as the next trillion-dollar industry, okay? And you can do a simple wellness program, and you will fix a lot of people. A lot of people will improve greatly from it, okay? You get better results, you'll get referrals, and you'll be able to market to the public to get new patients. One of the reasons a simple wellness program will get you great results is most disease is inflammation. Most of the chronic problems your patients have is self-inflicted. Okay, about half the nation is insulin insensitive because they ate too many refined carbohydrates. Okay, if you start addressing that, you're going to get a lot of people better from a lot of things. And I don't just mean weight loss. I'm talking about allergies. I'm talking about fatigue. I'm talking about headaches. But you have to be proactive and you have to do it. And if you address inflammation and just basic nutrient deficiency, 80 to 90% of your patients are going to improve tremendously. So if you do basic wellness on all of your patients, you'll get better results, you'll increase your income, and you can market it and do very well financially. So all a wellness program would consist of is 4 basic components. A diet, like an anti-inflammation diet. Now, I represent a company called Whole Health America. We provide these kinds of things. We produce marketing materials for you. But basically you want, what used to be called an alkaline ash diet. You want to get people off of grains and meats and have them eat more fruits and vegetables and nuts and seeds. The paleo diet is a good one, but you want to go vegetable heavy with it. Like I say, we can make a handout for you. A good multiple vitamin, essential fatty acids, and a probiotic. If you do that on every patient, you'll be surprised at how much better people get. I'm going to give you a couple of histories to illustrate this. One of the very first patients I ever had was a woman who was an artist, and her skin was peeling. It was sloughing off. Her hands were raw and red. She had been to an internist, and then she went to an allergist, and she went to a dermatologist, and she'd been to all these doctors, and what they came up with was a steroid cream that wasn't doing her a lot of good, and she kept getting worse. I had her fill out a diet. Her diet consisted of 8 servings of butterscotch pudding throughout the day, no water, a lot of coffee, and a pork chop for dinner at night. Okay. We simply changed her diet. I didn't even do that much supplementation back then, and she cleared up. Another story is I had a 4-year-old come into the office, and had been having ear infection. Had a couple of ear infections every year of his young life, and carried into the office with him a purple-colored sugared drink and Ritz Bits. Okay. And at the time, I was really concerned because I was saying, "Oh, I've been on antibiotics a lot. Do I have to do kind of a yeast cleanse or candida or that?" I did a basic program. I gave the multiple vitamin I used was a liquid one from Biotics Research. So I gave a folic acid B12 supplement because liquid multivitamins, folic acid's not so stable in there, and I wanted the folic acid in there. We had a flavored essential fatty acid, like a lemon flavored fish oil, and some probiotics. I never saw the kid again. Okay, we changed the diet. The mother called me a couple weeks later. Everything was great. Kid was doing really, really well. So just because the treatment is simple, I think you'll be surprised at the complexity of the problems that will improve. The trick is to be very consistent with it, to insist on the dietary changes and get people better. Also, healthcare is like peeling an onion. If the patient does not perfectly improve at that point, you can always add other therapies. And this series is going to offer some protocols and some strategies for nutrition. This is kind of like your basic math class in high school. If you don't do any nutrition in your office, this will get you started and get you using a credible thing that will get result. And if you do nothing but this wellness program, I think you'll be very surprised at how many kinds of patients you get better. During this series, we're going to be recommending products from Biotics Research. The quality of Biotics is really good. It's not that they're the only good quality vitamin company that there is, but the thing that I really like about Biotics for a doc who's getting started with nutrition is you've got a lot of support there. Their people are very well trained in nutrition. They don't try to sell you the flavor of the month. They honestly will help you with your patients. And I've been in practice for 30 years, and I haven't seen a company that consistently does that the way Biotics Research does. They have lots of resources for you, and it's a good company to expand your knowledge with. Will you use other vitamin companies? Well, sure, hopefully. I mean, I have an agreement with Biotics. I see other vitamin companies, and they see other doctors. The Eat Your Way Out of Pain handout is from Whole Health America. We'll give you some contact information for Whole Health America. We offer various web services and marketing information for you, and we'll get into that a little later. I'm really more interested in getting you started with a workable program than trying to sell you a lot of stuff right now. And if you have a company that you like better than Biotics Research, fine. But give every patient an anti-inflammatory diet and just some basic supplementation. The other thing is, if you know a little bit about nutrition, you can fine-tune this. It's not that there's something magic about these three supplements. You might, for instance, have someone with asthma and say, well, maybe I'll give them a little extra magnesium because magnesium there's a lot of research that shows that it helps relax the airwaves. In fact, IV magnesium has been used to stop asthma attacks, like in an emergency room. So you might fine-tune this depending on your knowledge. The point I'm making here is not that there's something magic about those three supplements. It's just that if you do nothing else and give those three supplements, you'll get nice results. And think of the wellness program as a beginning. Health is like peeling an onion. But you can go from there and tell the patient, we're going to start with these dietary changes. I mean, you might find gluten sensitivity. There's, we have symptom questionnaires. You can do blood chemistry. There's other things that you can do to expand from there if you're not getting a great result. But I'm telling you, if you do a wellness program and you give a good adjustment, you'll be amazed at how many people improve. And wellness is something I like to call a turnkey program. It's something that you don't have to spend a lot of time doing, a lot of thought on, and you do get a good result. So even if you're in a busy practice and you're adjusting a lot of people, you can still transition into this, especially if you have the right kind of materials in your waiting room, which we will get into in the marketing section. Another turnkey program would be something like the 3-Step Detox, which is offered by Biotics Research. They have a lot of marketing material for it. If you contact your Biotics Research rep, they'll help you with that. And all this material, like I said, there's going to be a series of short, maybe 15 minutes, give or take a little, videos. All this material is in a manual. It's got protocols, it's got marketing information, it's even got communication information. Okay, and if you go to practicebump.com and use the coupon code nutrition, you'll save 60%. It brings the price to about $20, and it's not like I'm trying to make $20 off of you, but I really feel that if you want to start doing this, if a small investment will make it so that you'll do it. If it's a free download, people download those things, they forget they got them, and they don't use it. If you spend $20, chances are you'll do it. And the goal here really, really, really is to get a lot of chiropractors getting really good results. And like I say, we're going to go into some other protocols and some other approaches for nutrition. But for now, just start with the nutrition, with the wellness program. I'm Dr. Paul Varnes. My company is Whole Health America. If you have questions, my phone number is 773-519-0007. I do better with email. You can email me at onearborvitae@comcast.net. Thank you for your time. I hope you found this useful.